What are the goals of treatment at Relapse?
The goals of treatment for a patient with relapse myeloma, I think, are really twofold. The first is to control whatever symptoms the patient's having. If a patient has relapse with bone disease that's painful, or kidney dysfunction, or high calcium, or anemia, similar to the goals of therapy at newly diagnosed, is to control the symptoms. That's the first and foremost. And secondly is to control the disease for a prolonged period of time. We now, particularly for patients who have first relapse, we now think about first relapse disease to really try to control the disease for a long period of time, similar to how we control the disease in the newly diagnosed setting for a long period of time. When the goals somewhat shift in later relapses where their treatments are more difficult, and then, as we always do, it's more of a balance between controlling the disease and maintaining quality of life. And I would say that in addition to the two things I mentioned, trying to maintain quality of life during treatment, is just like we do in the newly diagnosed setting, remains important in the relapse setting.
The first goal is symptom control, because you don't want anybody to have any organ damage, any end organ manifestations of myeloma. And that's bone disease, abnormal kidney function, high calcium level, frequent infections, or anemia. With that said, if somebody's being monitored on a regular basis, more likely than not, they will not have a symptom at relapse. They're just going to have what we call biochemical progression, which means the proteins in the blood or the urine are increasing to a level that's no longer acceptable. And we choose that level. There's a definition of how much protein is too much protein. And that's based on certain guidelines called the IMWG criteria. And they have a definition of what's considered progression or relapse of myeloma. And the reason we have a set number is because we don't want patients to have symptoms. We want to catch the cancer before it causes harm to the body at a level much, much lower than it was when they first presented with the disease. So when that definition is met, that's considered a relapse.
So what are the goals of treating relapse and refractory patient with multiple myeloma? Really, the goal is to give them the best response for the longest period of time and maintaining quality of life. So that's why we need to do the research. We need to do clinical trials that address these three goals: quality of life, duration of life, and quality of control of the disease. And I really think there are a lot of trials trying to address that. So I encourage patients with multiple myeloma to enroll on clinical trial. So these are the goals. I mean, I would find a regimen that is patient-friendly, very effective, and can lead to a lasting response.